Hey everybody, this is my first video on pregnancy massage, and my daughter-in-law Leah is going to be my model today. We're doing this a homespun thing. My son Dakota's doing the taping, and their 2.5-year-old is running around in the yard with his great aunt. So if you hear squealing outside, that's him, and don't worry about it. Okay, the first thing I want to show you is how to get comfortable in bed, okay? And some of these positions I'll use during massage and some I won't. For women who are having trouble with their shoulders and like to sleep on their back when they're not pregnant, you can take a pillow like this and fold it in half, or you can use a rolled up blanket to put behind your back. What you're going to do is put that behind your back, and then Leah, go ahead and roll onto it. You want that pillow to go from the shoulders to the hip, okay? And then you can, if you want, straighten out your top leg a little bit. So bring this top leg like that, okay? And then if you when you're not pregnant, you're a stomach sleeper, the thing that you can do is roll this way, Leah. Put this arm behind your back, okay? And then Leah's not pregnant, in case you didn't notice. She's not, but we're gonna pretend that she has a big belly, and we're gonna stick this wedge pillow. It's just skinny on the bottom and wide on the top. We're gonna stick that under her belly. You could also use a rolled up hand towel or a small bath towel to support the belly. But this wedge is really nice. A lot of moms really like that. And then we take this pillow that's between her knees and bring it up higher. And then Leah, you go ahead and roll way forward. So obviously she's not pregnant, so this is really easy to do, but women can do this with rolling way forward all the way up through labor. So you won't smash your baby. And it can sometimes help, midwives will use this during labor to help turn a baby that's in a weird position. Okay, so these are just alternate positions. You could do massage with her in either of those positions. But to start with, what we're going to do is have you, Leah, bring this bottom arm back out in front of you. We're going to have this wedge pillow under her belly, and then a nice firm pillow between her knees and ankles, so that the goal is to get the knee and the hip more or less in the same plane. If she were uncomfortable, I could add a second pillow to that, just to get these more in an even plane. Alright, so now we'll get started with the massage. One of the things is to make sure that the person on the table is really warm, and so I'm just going to cover Leah up a little bit. It's a little chilly in here today. Keep her warm. You want to make sure that your hands are clean, your fingernails are trimmed, so that if you look over the top from your palm side of your hand, you shouldn't be able to see your fingernails. You want to get yourself kind of in a calm, relaxed state so that you can really focus on the massage. So whatever you need to do for yourself to do that, that's important. Then what we're going to do is just start at the neck and shoulders. You can hold the feet or hold at the shoulders to start with if you want as well. That's nice, a nice way to center yourself, but I'll just start here with one hand on her neck and one hand on her hip. And then what I'm going to do is just start to massage the neck. Okay? I'm going to squeeze under the occiput and kind of pulling the tissue away from the spine. Squeezing down the neck. And if you want to work on the head, you can take this pillow like I showed you before and put it behind her back and have her roll onto that pillow. Okay. And then in this position you can massage the occiput again, that's the base of the skull. And there's a lot of muscles that attach there for both the head and the neck, and so it's a really good place to work. With that, I'm just using my fingertips to press the tissue against the bone of the occiput. You can do a rubbing massage on the head, all over the scalp. You can take the hair down so you can really thoroughly massage the head. Excuse me, there's a little bit of pollen going around today. So massage the whole head, then have her turn face up and massage the forehead with your thumbs. Each time I go a little bit lower when I do that stroke across the forehead. And then into the eyebrows. You go along the cheeks, the cheekbones, and into the jaw. And the jaw is really important for anybody, but especially a pregnant woman. If her jaw is tight, her pelvic floor is tight. And then you can massage the ears. And there you're going to be squeezing enough to really turn the ears bright red. And that will release the neck and shoulders as well as the ears. And all of this stuff that I'm doing, I'm going to go kind of fast with it, but you would want to take more time. Okay, Leah, go ahead and roll onto your side. Alright, so then I'm going to move back to the neck and the shoulder. I can just do that squeezing again on the neck, because in the side lying position, neck is a little harder to get to than when somebody's face up or face down. So just spend a little more time with that. Then I'm going to go across the shoulder. And then I'm going to go down between the spine and the shoulder blade. I'm also going to go under the clavicle or the collarbone and press in there. That will really release the neck and the shoulders. And you can do a little bit of rocking in there. I'm working on Leah today with clothes on, just because this is how I demonstrated in class, but you certainly can do this with her naked and using oil. Okay, when I work through clothes, I do more of this pressing and rocking than I would do if I was working with oil. Then I would be doing more gliding as such. Then to do the arm, you can either do it from the back of the body. If you're doing this massage in your bed at home, you would have her on the edge of the bed and you would do everything from behind her. So you can do that, or you can go around to the other side of the table and work from the front. And this is more comfortable for me. And then I'm going to put a pillow under her arm and bring her arm forward. When I work on the arms and the legs, I start with the upper extremity and I work towards the heart. That way, if she has swelling in her hands or her feet, I'm going to clear a path for that excess fluid first in the upper extremity, so that when I'm working in the lower extremity, that fluid has somewhere to go. So you can do long strokes like this. You can do pressing and releasing. whatever part of the body you're working on, you want to pay attention to what the muscles feel like under your fingers and thumbs. And if you find a knot, if your partner says, ooh, that's a tender spot, then you want to give it some extra pressure. Okay? If somebody has carpal tunnel and they're really having a lot of pain and tension with that, a good technique that you can do is this twisting of the arm. You want to really stretch the skin and the fascia beneath it to release that carpal tunnel. And this is something that you can do a couple times a day, every day. Even if you don't do any of the other massage, you can do that, and that's going to make her feel better. Then you go into the hand and do some nice squeezing. You can do what's called a coin rub, where you rub between the thumb and the side of the first finger. First the top and the bottom of that finger, and then the sides. You can work the webbing between the thumb and the first finger. This is the Hoku point, or the point of well-being, that governs the large intestine, and it helps with digestion. It can also relieve headaches, and it helps with constipation. It can relieve constipation as well. I'm going to do all 5 fingers, and then squeeze the palm. I'm pressing in from underneath with my fingertips, rolling the palm around my fingertips. That feels good. And with hands and feet, you can use a lot of pressure. People like that deep pressure. Then I'm going to flip the hand over, and I'm going to interlace my fingers with Leah's fingers. So I'm going to take my pinky and ring finger between her pinky and ring finger, my pinky between her middle finger and first finger, and then 2 fingers between the thumb and the first finger. Okay. And then I'm going to splay the hand open, and with my thumbs do really deep pressure. And this is deeper than you would think. So when you're doing this for the first time, just keep going a little bit deeper and a little bit deeper than you might think she would like. And then check in with her about your pressure. Okay? So that's the hand. Leah, you can put that right there. All right, so now you wouldn't normally have Mom roll over to the other side, but I just did, just for the video purposes. So what you would normally do is you would work one half of the body from the shoulder to the feet, and then have her roll over and work the other half. But for our purposes today, we had her flip over. So now I'm going to work on the back, okay? And I'm going to start up at the shoulders with 2 thumbs and press in. Release, press in. You can do that all the way down the spine. For those of you who have taken my 16-hour class, you would have practiced this when Mom was sitting in the chair. Or if you're getting ready to take the class, you will practice this. And in that situation, you would have 1 thumb on each side of the spine. But when we switch it over to side lying, you're going to work always above the spine. And you can go all the way down into the buttocks with this. You can also do long strokes down the back. You can do windshield wipers, where your thumbs are going kind of over each other. That's a little easier to do when you have oil, where your thumbs are going kind of like that. Oil directly on the skin. But with the clothes on, the main thing is just pressing and releasing. Okay. Always take time when you move into a new area to check in with mom and make sure that the pressure is okay. How's this feeling, Leah?
Feels good.
It's okay. There's a lot of pollen flying around today. So while I'm going down Leah's back, I'm finding that she's got some tension in her low back, and this is very common for any body, but especially a pregnant body. So in here, you want to do fairly deep pressure, but you want to go in really slowly. Okay? Press and release. Press and release, and checking in with mom, making sure that she's okay with that pressure. Okay? And there I'm pretty much just holding firm, steady pressure, not a lot of rubbing and gliding in there. Okay? Then when you get to the hip, you can do a kind of a seesaw motion. One hand is above that iliac bone or that hip bone, and one is on the face of it. And just back and around. You can, with this hand, kind of put your fingers in a little bit on the front of that bone. But again, you're going to have to go with mom's tolerance. Okay, some women are super ticklish, and so that would be uncomfortable. But it can really help release the low back. You can do that. Then you can move into the buttocks, and what I want you to pay attention to here is the outline of the sacrum. Okay, the sacrum is a triangular bone at the base of the spine, and you can kind of see I'm outlining it here. Like I said before, everywhere that muscle attaches to bone, if you work there, you're going to release that muscle more effectively. This will help release the muscles of the buttocks, help with some of the muscles of the pelvic floor, and also during labor, it can help with pain and to progress labor. So there's a lot to be gained from working here. During labor, a lot of women want deep pressure on their hips and buttocks, and so this may be the only massage you do during labor is on her hips and buttocks. This area, for some women, they want super, super deep pressure, and for other women, they can't tolerate very much pressure at all. So when you start working on this area, you go lightly and work your way up. And again, get feedback from mom. Okay? One of the things that can help during labor is to work a little bit lower than most body workers are going to go, going way down to the bottom of the sacrum. Okay? And doing deep pressure there. That can feel really good. This is a little tricky territory, and so one of the many reasons why, if you have time to practice massage before mom goes into labor, the better results you're going to get during labor. You're both going to get more comfortable with the work, with you giving the work and her receiving it and giving you feedback. So even if you don't practice a full body massage, I would really strongly encourage you to practice down the back, the low back, and the hips and the buttocks. You can do some rocking like this with your fist. During labor, some women during the contractions want just this kind of pressure. Okay? But this working with mom on her side during labor is often a really good way to help her rest and relax during labor. Okay? Now there's a lot of other things you can do, but just play around with it, practice, and get your skill up a little bit before mom goes into labor. She won't complain if you tell her you want to practice giving her massage once or twice a week. All right, so now what we're going to do is the legs, which are kind of just like a big arm with the foot at the bottom. So we're going to start at the knee and work towards the hip. And here you can glide. You can glide into the sits bone, especially if mom is having like pain on the side of her legs and her IT band. Sometimes this working up here can be really good, okay? I'm just going into the sits bone and making contact and then working on the tissues around it. But there's a lot going on there, so it can sometimes really help. You can do the squeeze and release like I did with the arms. And just see, imagine, have your intention be that you're moving fluid up towards the heart. Okay? Now, if she has varicose veins that pop out when she's standing, then the massage on the legs should be really gentle. If you have any questions about it at all, you can ask me about that. Email me or call me or whatever. But it's still, with women who have varicose veins, the massage on the legs can really help with circulation. You just have to be careful with them. Then I'm going to move into the calf. I'm going to straighten her leg out just a little bit. Just bend your knee like that, Leah. There we go. That mostly made it easier for me to reach what I'm doing, but also when you don't have the knee bent as much, the fluid can move a little better. So here I'm squeezing and releasing, moving up towards the heart. And you can see I'm also incorporating a little bit of jiggling and rocking. And that jiggling and rocking can kind of settle the whole body down. Okay. Are you okay with me taking your sock off?
Yes.
Okay. So I'm going to remove Leah's sock. I just like to get into the foot that way. But if mom has very ticklish feet, working through a sock or a sheet is going to make her less ticklish. So here I'm just grabbing at the heel, grabbing and pressing my fingertips into the base of the foot, the sole of the foot. Again, pressing in with my fingertips and wrapping the sole of the foot around my fingertips. And deep pressure is good. Another trick if somebody's really ticklish is that you squeeze, release, reposition, squeeze, release, reposition. That you're not gliding at all. We'll do the toes the same way we did the fingers with that coin rub on the top and the bottom, and then on the sides. I'm going to do all the toes. And squeeze the foot. Now, just for review, for those of you who got the massage demo in class, I want to show you the points on the ankle and foot that stimulate labor. And Leah, sorry, I got to take off both of your socks to do this. So spleen 6 is 1 hand width above the ankle bone, this bone that protrudes on the inside of the leg. You find that and you press it up against the bone. So you're coming from the back of the body into this bone. And it should feel tender. The mom should confirm that, yep, you found it. Now the other one is this one on this little indentation between the ankle bone and the apex of the heel. This is in foot reflexology, this is the uterus point. So this uterus point will stimulate the uterus to contract. So if labor is not moving along very quickly you can massage this point and get it to the uterus to contract more effectively. This one, the spleen 6 point, can also cause the uterus to contract more, make it function more optimally, but also can help with pain during labor. Okay, it's recommended that we not do a whole lot of massage on these points until about 37 weeks. All right, so after you finish the first side of the body, then you're going to have mom roll over to the other side. You don't need to repeat the head and face, but you will do the neck, the shoulders, the back, the hip, the buttocks, and the leg, and the arm. And then at the end, if you would like, which is always really nice, is to massage mom's belly. Okay, now we're just going to use our imaginations with Leah. One of the things that helps is if mom is back closer to you to reach. So Leah, if you could just scoot your hips and your shoulders back towards me. You're not going to roll, you're going to stay on your side and scoot your bottom shoulder. There we go. It just makes it easier for me to not be leaning way over, okay? Whenever we massage the abdomen, whether a person's pregnant or not, we always do a circular stroke in a clockwise direction. That's if you were looking at her belly, you would imagine a clock face and go in the clockwise direction, okay? You do what's called a sun-moon stroke, where one hand is doing a full circle and the other hand is doing a half circle, okay? Then when you get down to the bottom, you're going to just scoop up her belly and kind of lift a little bit. And that takes a little bit of the weight off for mom, okay? That's all you need to do with this. It's a pretty gentle stroke. You want to use enough pressure that she won't feel ticklish, but it's not a deep pressure at all. You're not working out muscle tension. You're just helping the tissues kind of stretch and release a little bit, okay? And then you can, with quiet hands, hold your hands over mom's belly, feel the baby, tune in, let yourself connect your heart energy to mom and baby. Sometimes people will also have one hand on baby and one hand on mom's heart from behind the body. And that enables you to really make that connection between mom's heart, baby's heart, and your own heart. Okay? And that's it. Hope this was helpful. I appreciate any feedback that anybody has for me on this. This is my first attempt, like I said, and enjoy your massaging.